this is the start of our infusion center. Dr. Chitani is the physician that actually designed and has set up everything on behalf of the state. We're providing it to the citizens of Lubbock and the region.
Right.
No cost. Like to emphasize that there's no cost for any of the infusions that will take place in this facility. The only things the residents will need will be a referral from their primary care physician and an appointment, and that will all take place through that referral system. So we just encourage everybody to, you know, if they test positive, to immediately contact their physician and see if they qualify. There's very specific qualifications, and if one of the doctors want to speak to those specific criteria that the people have to qualify for this therapy.
Well, Doc, what specific services are you going to offer here at 50th and University?
So, Judge, we've got 10 infusion chairs over here, and what we are offering are monoclonal antibodies that are being provided by the state at no cost to the patients. We will be giving that monoclonal antibody once the patient has gone through the referral system, has an appointment. They come over here for 1 hour. They sit in the chair. They get infused. After that, we observe them for 1 hour to see if there are any side effects, and after that, they can go home. So essentially, it'll take them about 2 hours and 15 to 20 or maybe 30 minutes to go through the entire process and then be able to go back home. There are 2 different types of drugs or monoclonal antibodies that are available, and both have been provided right now through the state to us so that we can start that process as soon as possible. This drug has been approved, has an emergency use authorization through FDA, is safe, potentially not serious effects or side effects drug. So it's a very good thing that the state is doing what they're doing for the citizens, and Lubbock what is doing for the citizens over here, because here you have the hospitals filled up, you have no capacity in the hospital, and we have a treatment that is available, and essentially what the state is doing is making sure that the citizens can get that treatment.
Doc, you've got, what, 10 stations here? It takes about an hour, you said, to go through. So how many patients do you think you can move through a day over here?
So with the 10 chairs that we have, we potentially can move anywhere between 25 to 30 patients per day. Because there is a time limitation. Each chair will take approximately 2.5 hours to, process, be used, and then the patient to leave the facility. Sure. And we are, so that's what we will be able to do over here. Essentially about 25 to 30 patients per week.
Ready to go, it looks like, in the morning, right?
Yes, sir, we are ready to go, and we will have a start tomorrow. Everything looks good, and with the help of TIDM and their leadership, we've been able to achieve this objective.
So, Doctor, you've Ashbrook's done several of these around the state,
Yes.
A handful roughly, right, I think. Have you been involved in setting those up?
All of them.
Okay.
So,
you've learned, I guess, as you've gone around the state and done that. So tell us what you bring to us, having learned in the Valley and Fort Worth and the different places. I saw the list. I can't remember all the places you are.
So we've gone to multiple locations and set these up, and obviously we've learned a lot of lessons. One of the most important lessons that we've learned is that there has to be a very solid referral system established through the city and through the state. Essentially, the state folks lead it, but city has to be involved. The health department has to be involved in a big way, and the hospitals, as they have been involved so far, coming all of these pieces together is what success is. Without all of these pieces coming together, if the referral system doesn't work, even though we have the facility, we have the chairs, things are not going to happen. The other very important thing that we need to make sure that is clear to the citizens of Lubbock is that this is an FDA emergency authorization use product that has been, is safe. It does have minor side effects. Their providers will tell them about the side effects, very minor, but we observe them for 1 hour, and that's the protocol that FDA, CDC, and the various other national organizations, authorities have kind of implemented. So,
Doctor, this is the antibody, these are the therapeutics that we've had in our market now
Yes.
for roughly 60 days, right?
more than that.
And it seems like it was yesterday, but we feel like they've been successful in helping drive down our hospital admissions. This is something that we're trying to do with somebody who has just been tested positive. We want to keep them out of the hospital, correct? Is that right?
Absolutely right. What we are looking at are individuals who tested positive, have had the disease no longer than, or symptoms for no longer than 10 days. They have a mild form of the disease or moderate form of the disease, and now we can give them this monoclonal antibody. And what this monoclonal antibody will do is hopefully not have them go to the hospital and it will prevent them from developing severe disease so that they will not go to the hospital, occupy the hospital beds, occupy the intensive care unit beds, and we are hoping that that ultimately is going to save lives.
So the other thing I want to add, I just want to encourage everybody, it is not a walk-up site. So no walk-ins will be allowed. They will have to get a referral process in order to have the appointment made here. They're just not staffed to be able to see patients for the medical side of it. They're only allowed to do the infusions. There will not be like primary care physicians here on this site. So we encourage everybody to go to their own primary care physician to get that referral so that they can then get that appointment made and be seen here.
So we have 3 large physician groups. So the Covenant group, the UMC group, and the Texas Tech physician groups. They certainly would understand the protocol on how to get somebody scheduled. What about an independent physician? Or is he or she going to know how to do that, or is that a place where they need to interface with the health department?
Yes. So the local health department already has an amazing referral process in place that they're doing to kind of facilitate that process here in the city of Lubbock.
And if a patient has a question and they don't have a primary care physician, we still might direct them to 775-2933 to the Lubbock Health Department, where we've got extra people still answering the phone that can try to get them to a primary care physician so we can get them here for treatment. Okay. Dr. Ryan, you want to?
Yeah,
Dr. Ryan,
want to thank Covenant.
Why don't you
Big time, yeah.
come over here, Craig? Dr. Ryan's. We've been working on this for 60 days. The Covenant knew they were going to be moving out of here, or Grace did, and so Covenant's been a very good partner in this, and the judge and I have been very much in the background. They try to keep us out of this top stuff, as you might imagine, but it might be important to, from a physician's standpoint, to talk about, why this is important to the hospital.
Well, this is important for the hospital for the reasons that have already been listed. We want to keep as many people out of the hospital as possible. We think that the addition of this infusion center, in addition to the 2 that are already up and running here in Lubbock, will serve that purpose well. And we want to keep our patients healthy. Even if they do contract, COVID-19, we want to get to them as early as we possibly can. And we feel like by giving them these treatments, we can substantially reduce their risk of hospitalization, and that's the entire goal.
What have you heard from your patients who have already gone through these therapies?
It's very interesting. The monoclonal antibody therapies are new, they're novel. There's not a lot of data that supports them, but anecdotally, we know that the patients that have gone through these treatments seem to have had a shorter duration of symptoms and a much faster recovery. So even though there's not a lot of hard scientific data that supports the use of monoclonals in this particular disease, of course in this particular disease there's not a lot of hard scientific data about anything. So we think that the monoclonal antibodies have substantially reduced the hospitalization rate and substantially reduced the duration of their disease process.
And so hopefully expanding our capabilities for that will further help our hospitalization situation.
Absolutely, that is correct.
The other thing, I guess, Randy, that is a little different about this is the regional focus of this center too. So physicians in surrounding communities that may not have this resource, instead of having to rely on Covenant and UMC, this is a great place for because these patients are We want them to get well. We don't want them to go to the hospital. Easy to get to this, plenty of surface parking. 50th University's, everybody knows where that is in Lubbock. So that's another, I think, a significant draw to this location.
It also brings some clinical capability and geographically distributes it around the city a little more equitably, so that it's easier for the citizens of East Lubbock to get here and to get treated and to not feel like they have to go all the way across town to achieve what we're trying to accomplish.
Excellent. Okay.